Well, as we know, COVID-19 can potentially cause a lot of health complications for those who test positive for the virus. Vascular doctors are seeing this firsthand in the patients they're treating, and it's serving as a reminder of just how important our vascular health is, even outside of COVID. Joining us now to talk about this is Dr. Ralph DeNatale, a vascular surgeon with the Hartford Healthcare Heart and Vascular Institute. Doctor, welcome.
Thank you for having me.
Thank you for being here. So you've been called in to consult with hospitalized patients who are suffering from COVID. What type of vascular issues are you seeing?
Well, as we know, COVID doesn't just affect the lungs of the body. It has been affecting the vasculature in the body. We're now seeing patients with heart attacks, strokes, blood clots that form in the leg that is called deep venous thrombosis. These can occasionally travel to the lung, causing pulmonary emboli. We also see blood clots that form in the arteries of the leg that can lead to gangrene and limb loss. The bad news is that these patients do not have pre-existing diseases to explain this. The good news is that we know how to treat this now, so most patients that come into the hospital with COVID get placed on a blood thinner to try to minimize this. As you can see, this is a very serious virus.
Okay, talking about vascular health in general, what are some of the biggest issues you see with patients?
Well, vascular surgeons often see diabetics that have leg wounds. They could be wounds of the leg or the foot that are either slow to heal or non-healing or actually getting worse. This can often be due to poor circulation of the extremities. And not paying attention to this or treating this could lead to gangrene and limb loss. The other things we see are carotid artery disease. Now, as you know, carotid arteries are found in the neck. They supply blood supply to the brain. There can be blockages in these arteries, and these can go on to cause strokes. Some of the warning signs we see are temporary loss of vision in an eye, temporary loss of function of an arm or a leg, and occasionally speaking difficulties. These are all warning signs. When these occur, you need to get yourself in to see your vascular doctor as soon as possible.
All right, what would your advice be to someone who could be putting off these health issues due to the pandemic?
Don't do it. See your doctors. We are here seeing patients every day. Do not pull things off. What you think might be routine is not routine. We're here for you. Come and see us.
All right, and finally, what are some issues quickly that contribute to poor vascular health, and how can we avoid it?
Well, diabetes, high blood pressure, high cholesterol, and obesity are all factors that could really impact your vascular health. These are all treatable issues, either with medicines or with exercise and diet. Taking care of these problems now by using your physicians for this care will pay dividends in the future. You will not regret this. Myself and my colleagues, who are all vascular surgeons, we're here for you. Whenever needed, we're here in New Haven and North Haven, Connecticut.
And of course, emergency rooms are always open should people have symptoms, right?
Never hesitate. Use us.
Dr. Ralph DeNatale, thank you so much for being with us. Great information.
Thank you.